and I start by saying, do we have your permission to take this video, use it for educational purposes out there on the internet?
Yes.
Okay. So start by saying, tell me a quick rundown of the symptoms or what we were experiencing before the surgery.
Well, symptoms, weakness and more pain. And I could notice the right leg wasn't moving as well as the other one. And just all around, just getting weaker and not being able to do things as well.
Talk to me about our ability to walk before the surgery. Kind of tell me the progression of how that weakness kind of started to take over.
I went from walking with a cane, and then I ended up with a walker because that was easier. And then that started to get difficult to the point the last month or so before the surgery, I couldn't hardly walk across the room, with a walker. It got so bad.
Mm-hmm. Now tell me a little bit about the symptoms or the changes now about a month or two after the surgery. How are we feeling at this point? What are the biggest changes we notice after surgery?
I noticed the pain went away pretty much. And they kept saying you should keep taking pain pills, and I didn't really want to anymore because I didn't think I needed them. And now I started a physical therapy, and everything was really slow, but it come around, and even the therapist was really starting to get pretty happy that I was coming back pretty good. And they got me on my feet about 3 weeks ago, and I got kind of emotional because I could stand without pain. And I just got to work hard. And everything seems to be improving every day, so.
Thank you for sharing that. That's, it's not easy. Absolutely. Now, the last part he kind of wanted to talk about is when we look at the image on the back, we see a lot going on in our thoracic area. And then there was just one level down there in our L5S1 that was causing all of this. Now, his big thing was we went to Mayo. And tell me a little bit about your journey with Mayo. What happened? We went and we saw them. They looked at you and we're here. So I kind of want to know about that because I'm not as familiar with that story. So.
Well,
that lower pain you had a long time.
Yeah. And I was.
And you told them about it.
Yes. And he had said, the exact words he said is, well, I asked about the pain in the lower back. And he said, well, we'll fix that when you do the other, he said. Otherwise, you just build your core strength up, and he's telling me doing that kind of stuff. And when he showed the scans, I could see there was a problem with them two vertebrae down there, but he just kind of brushed it off and never really said much about it. So
his main focus, from my understanding, was more of what we call the cosmetics.
Yes.
Of what did the spine look like on the image.
Yes.
So if you would be able to say that in your words, kind of how you felt looking at them trying to fix the radiology image, not you as an individual. Because that's a big thing that we try to focus on, is you as a patient versus
he
on paper.
Ended up there with his shoulder issue that he had. And he missed an appointment because the insurance had switched. It wasn't in the network anymore, but he ended up back there with the infection in his shoulder from a prior surgery. Well, then I asked if that doctor would come and see him.
Because I had back pain laying in bed.
He sent his assistant up, and we kind of got in an argument with her. I did. She said, well, you missed your appointment. I said, well, because he's not covered anymore. And you didn't. Well, that's all your troubles in your up above there. She said there's no need to look at that lower back. And she was, oh man, she told us he was the best surgeon in the country, and he's the only one that can fix you. And then I thought,
like, how
arrogant you know.
How dare you question his
when
ability?
there was a nurse in the room when this was going on, and she left. He said to me, "You really should report her."
File a complaint.
File a complaint, he said. So I just left it go, but no, that's what happened there.
And that is, as a provider, I'm a PA too. It's like that irks my bones, makes me very sad.
She was an understudy of his, you know, and the attitude she had.
Well, then that leads me to a point that I hope I can get a better statement from you, because you had surgery at our ISSC, correct? In-house. I want you to tell me a little bit about your experience with Inspired Spine or our staff or anything. Again, good and bad. I want to know about it. No sugarcoating, but I want to kind of know about, because that's what I take pride in, is individualized care, caring about the person versus
the staff.
arrogance.
Staff was
terrific.
fabulous.
Couldn't get any better.
I couldn't ask for any.
The only thing, well, it wasn't Dr. Abbasi's fault either. He didn't realize how far he'd slid backwards.
Because I didn't see him.
Really, he was to the point he probably should have been taken to a care center right away instead of being sent home. That was the only issue. Because we really had a hard time taking care of him when we got him home.
I could imagine the change and trying to get you. Yeah. So my favorite question is, Kevin, tell me, I know we're not even close to being done here. What are your favorite, or what are you enjoying the most since after surgery?
Just the pain, and just feeling a little bit normal again,
And you're getting stronger.
Yeah, and everything's going the right direction.
Turned around.
And then I guess I have one last question. I always say, if you were watching this patient testimonial before you had the surgery, what is your best advice? What would you like to tell yourself if you were watching this back?
Go for it. I don't think you'll be sorry, because I'm not.
Any last comments? If not, I thank you so much for taking your time. I know this was